Okay, today's question is, does insurance cover TMS for OCD? It's a long question that you see here on the screen. We answered the first half, which is, extended treatments or retreatments. But the second half is, what if the patient has OCD? Does that allow for like extended or more treatments or what have you? So let's take a step back and remember what are the indications, today's indication for TMS based on the FDA clearance. The first one, which is the oldest of the bunch since 2008, is treatment of depression. So sometimes insurances will twist that and say treatment-resistant depression, and then you ask them about what do you mean by treatment-resistant depression, how many medications, failures, and what have you, and each insurance has their own criteria for that. But science-wise and FDA clearance-wise, it's treatment for depression when one antidepressants in the past had failed. But that's the first indication. The second indication is for OCD. So there's a subtype of TMS called DTMS that is FDA cleared using a particular coil called H7 coil from a company called Brainsway, or a coil called DB80 coil from a manufacturer called McVenture. Those two coils are FDA cleared for the reason of OCD. Number 3 is for the reason of smoking cessation as an adjunct treatment. So if a patient had tried, to quit smoking with medications, with therapy and what have you, and they failed, then they can do TMS, deep TMS as well, using a coil called H4 coil from Brainsway for that reason. And that opens the door for a lot of addictions as well. Number 4 is the most recent one, which is anxious depression. So H1 coil from Brainsway is FDA cleared for the reason of anxious depression. Okay, all right. So the most common indication out of all of those is depression, and that's what TMS is known for. But then the re-emergence of, or the emergence of this new data about OCD with provocation, meaning we excite the obsession that the patient has, and then we deliver TMS to the patient brain, had showed a good clinical response in randomized controlled trials, and for this reason it was granted FDA clearance. Now, would insurance pay for that or would they not pay for that? So it depends on which state you're in and what insurance do you have. So because this is new, so now we are in the stages of advocacy to make sure that insurances consider such a treatment for OCD. Particularly obsessive compulsive disorder is one of those very, very difficult illnesses to treat, and we have very limited number of therapies and medications that actually shows efficacy. So having a new tool in our box, which is DTMS, is very helpful in this situation. So yeah, in my state in Florida, currently none of the commercial insurances has a policy for coverage for OCD. And Medicare, the government insurance, does not have a policy and will not cover OCD as of the new LCD criteria that is coming up in the next few months that they're reviewing now. They still insisted on not covering OCD. I objected that, and I think it should be included. The evidence is solid. It's not the most impressive effect size that we had seen, but that's enough evidence to actually support a treatment for such difficult disorder to treat. All right, now I want you to remember that there are only 2 coils that can do this OCD treatment, right? So why am I saying that? Because sometimes you could see a clinic like mine that uses figure of 8 coil, the coil that we place in only one particular spot of the brain. It's not the one that I was talking about with DTMS, the one that we place in only one spot. And you could see some of those clinics saying, oh, okay, well, we can do actually right-sided treatment to help some with OCD, or we could place it in the midline and that could help with OCD. The evidence there is not strong, okay? So I want you to be careful when you're saying, hey, does it, why not, add in treatments for OCD? Is the clinic you're seeing the one that has the coil for OCD? Because even Brainsway, not every clinic has all of those treatment coils that I just mentioned. And by the way, just to kind of give a little bit more details about that. Deep TMS uses H coil to stimulate larger area of the brain. Okay, so H1 coil is unilateral, though it could stimulate some parts of the other hemisphere, but it's tilted towards the left DLPFC. Okay, now H7 coil is bilateral, so it stimulates both areas of the brain at the same time. Okay, and it's usually stronger and deeper in stimulation. It's not the most comfortable coil to be under, okay, during the treatment. Okay, H4 coil, H7 coil is the one for OCD. H4 coil, which is the one for smoking cessation, is basically the same like H7 coil. They just slapped a name and a number on it and they called it a different name, to kind of get a unique clearance. Don't take my word for it. Go into the FDA papers and see mechanically how they said it's substantially equivalent. But they would tell you that it's a little bit different and what have you. We're not talking about that H4 coil, we're talking about the H7 coil. So why am I saying that? Because just the fact that the coil is actually in the helmet design does not mean that it's H7 coil, because the one for depression is also in the helmet. The one that is unilateral DTMS is also in a helmet shape kind of thing. So the interior of that helmet of how the coil stimulates, it's bilateral for the H7 coil. McVenture, which is a manufacturer that produces TMS devices and coils for so many years before BrainsWave was invented or NeuroStar was invented or came to market. They have been in the market for longer than that. They also produced a coil called DB80 coil. Actually did not produce it, they always had it. But it got FDA clearance because of how similar it is to H7 coil. And that one you can see it visibly because it's not really a helmet design. You can see how the shape of the double butterfly, what we call it, meaning that there are two circles, and those two circles in about 140 degrees, across each other. And the coil would be placed on the patient head, at the midline, to stimulate bilaterally. Okay, so that coil is also FDA cleared for the reason of OCD. All right, so the answer to the question, no, insurances in my state do not cover OCD treatment yet. I think this is emergent to change very soon. There are a lot of states up northeast and northwest and in other markets that commercial insurances are covering for OCD. Hopefully that will extend to everywhere. All right, thank you for the question. Disclaimer: although I am a psychiatrist, this is not a professional advice as I am not familiar with the specifics of your unique situation. Please contact a psychiatrist in your area with more questions. This disclaimer is added to my answers on social media after consulting with the American Psychiatric Association. Thank you.